Now we're going to talk about hypothermia and how does it affect different organ systems in the body. So hypothermia is basically anytime you have body temperature less than the set point of 37.1 or below, but it's more severe when it's around less than 34 degrees centigrade, and the severity increases from down on. So cold depresses body metabolic rate through Q10 phenomena. And what is Q10 phenomena? Q10 phenomena is basically rate of reaction increases 2 to 3 times every 10 degrees centigrade rise in temperature. And the normal values are between 2 to 3. So rate of reaction increases every 10 degrees centigrade rise in temperature. And if you have 10 degrees decrease in temperature, then you'll have the reaction rate decreasing by 2 to 3 times. So Q means every 10 means 10 degrees centigrade. That's how it becomes Q10, and that's how it affects the rate of metabolism in human body, that it decreases with cold. It's calculated as a ratio between rate of reactions at two different temperatures. So rate of reaction at T2 divided by rate of reaction at T1. So R2 over R1 with power raised to 10 degrees. So that's how that's the entire formula. So if you have if your body is cold, you'll Q10 will be less than 2, and if it's hot, it'll be more than 3. Q10 equals 1 is independent of temperature rise. For example, in tetanic contractions, in which you have sustained muscle contractions due to increased action potential. So applications of this Q10 phenomena is enzymatic reaction. We can figure that out. Faster reactions increase with increase in temperature, and you can figure out nerve conduction velocity. The nerve conduction increases with increase in temperature, just like enzymatic reactions increase with increase in temperature. You have muscle contraction velocity, 50% decreased muscle activity with 10 degrees change in temperature due to decreased basal metabolic rate. So when you have decreased temperature, you have 50% decreased muscle activity, and that is due to decreased basal metabolic rate, and this is basically due to decrease in O2 supply. When you have decreased basal metabolic rate, your body doesn't want too much oxygen, and you have decreased O2 supply, which causes decrease in ATP generation in muscle mitochondria, and that decreases the power of contraction. And this is how you have 50% decreased muscle activity. Hypothermic injury can occur in direct or indirect way. Direct way is frostbite. Water inside and outside of cell crystallizes. You have increase in edema, and decreased blood reaches the cell. That causes ischemia of the cell membrane damages, and you have necrosis, and that necrosis along with bacterial infection further leads to gangrene, and later on it leads to amputation. Indirect hypothermic injury occurs due to circulatory effects. You have vasoconstriction going on, edema, and hypoxia, which we'll talk about in detail now. So what are the mechanisms of signs and symptoms of indirect hypoxic injury? Let's take neurological symptoms. So decreased basal metabolic rate causes CNS depression, and that leads to drowsiness, slurred speech, mood changes, lethargy, and in real life you may actually can figure out if a patient is getting hypothermic is because he's changing his mood changes, his personality is kind of changing. He's getting lethargic, or he's getting drowsy. So these are some of the earlier symptoms which can tell you, hey, you may be getting hypothermic. Vasoconstriction causes decrease. So initially, body want to conserve heat, as we already talked about that in previous videos. The body want to conserve heat due to by doing vasoconstriction, and that decreases cerebral blood flow, decreases O2 supply, causes ischemic hypoxia, and symptoms can lead to, and this leads to symptoms in moderate hypothermia, such as ataxia, speech, and gait problems. But in symptoms in severe hypothermia are loss of consciousness, reflexes, and voluntary movement, along with muscular rigidity, and you can think of it as basal ganglia getting affected. Hypothalamus also gets affected. You have shivering that occurs in mild hypothermia, but shivering decreases with moderate hypothermia, and it is completely absent in severe hypothermia, because as you can recall that in severe hypothermia you have impairment of thermoregulatory center, and that is preoptic area of anterior hypothalamus and posterior hypothalamus. So what are the cardiac symptoms? Initially cold stimulates sympathetic nervous system to produce heat. You have increased catecholamines and increased vasoconstriction, increase in heart rate, and cardiac output. As in moderate hypothermia, as cold body temperature keeps decreasing, you have cold, severely depressing conduction system that decreases sinoatrial nodal depolarization, and that leads to bradycardia and decrease in cardiac output. Cold also decreases conduction velocity in Purkinje fibers. Now you have current taking longer time to reach ventricles. By that time, ventricles are not in refractory phase anymore, so you have re-entry of impulse in that muscle that is already ready to get excited, and this develops circus movement, propagation of action potentials that leads to tachycardia and ultimately leads to ventricular fibrillation. So normally, you can recall the signals are fast in heart, which disappear before cardiac cells become excitable, and cardiac myocytes have long refractory period, which prevents their excitation from disappearing impulse. But however, in this, when you have decreased conduction velocity, you have it takes longer time for the current to reach the ventricles, and by that time the refractory time period for them is already gone. They are ready to get excited, and by the time this current reaches them, they're getting excited again and again and again, and that creates a circus movement of action potentials. And this is the main mechanism by which you can have ventricular fibrillation in hypothermic patients. Decreased temperature also shifts O2 saturation curve to the left, and O2 binds tightly to hemoglobin. You have decreased O2 dropped off as a cell. That causes hypoxia. Vasoconstriction, along with decrease in BMR, also decreases cardiac blood flow, coronary blood flow. You have a decrease in O2 supply, causing ischemic hypoxia, causing decrease in ATP generation. Your ATP, your sodium potassium ATPase pump will stop working, and that will lead to the gradient that this pump was generating for sodium and calcium exchanger will also stop. So that will result in sodium calcium exchanger to stop working, and then you'll have no net movement of sodium in the cell, and calcium will not be able to get kicked out, and you have more calcium concentration inside the cell, causing atrial depolarization, and increased contraction of atrial myocytes that ultimately leads to atrial fibrillation. Moving on further with the cardiac symptoms, we have ischemia, impaired sodium-potassium ATPase pump, and sodium-calcium exchanger causes increase in sodium and calcium inside the cell that makes cell more positive, more likely to get depolarized, and this increased depolarization and calcium-induced calcium release in ventricles causes increased ventricular myocyte contraction and can further lead to ventricular fibrillation as well. So these are different methods, different ways cardiac manifestations can occur. You have ventricular fibrillation, and you can have in this way. You can have ventricular fibrillation due to circus movement of action potentials. So these are different ways. I'm going to show you how you'll have cardiac manifestations. So ischemia also, as we already mentioned, impaired sodium-potassium ATPase pump, sodium-calcium exchanger causes increase in sodium and calcium inside the cell. So recall that calcium has the highest driving force, E of an ion, and that prevents potassium conductance. And decrease in potassium conductance and decrease in potassium outward current can cause delayed after depolarizations, and that also leads to tachyarrhythmias. And if you want to know more, you can go ahead and take a look at this article. And another manifestation is of the Osborn J wave. That is also seen in hypothermia and hypercalcemia and ischemic conditions. But I'll show you how it occurs. So ischemia leads to decrease in ATP. We already talked about that, and that stimulates ATP-sensitive potassium outward channels. And normally these are closed. And but when you have decreased ADP, these channels basically you have opening of these channels, and potassium comes out and causes repolarization of membrane and hyperpolarization of membrane to stabilize membrane potential and prevent calcium from entering. So recall that, so when you have decrease in ATP, this stimulates this ATP sensitive potassium channels, and this is the same these are the same potassium channels, the ATP sensitive channels that are the targets of sulfonylureas used in diabetic medications. So that's something you want to keep in mind, because sulfonylureas close these channels for depolarization, and that's how they cause the release of insulin in the body. So decreased ADP stimulate potassium outward channels, and potassium efflux causes hyperpolarization of membrane, and this stabilizes membrane potential and prevent calcium from entering, prevent calcium overload in the cell, reduce contraction, and shorten the action potential duration. And this in turn conserves the energy that is required for contraction. And now you have less contraction, so you have less energy being utilized. And this further, this together coupled reduced contraction along with shortened action potential duration causes early repolarization in epicardial action potential, and that causes Osborn J wave at junction of R and ST wave. And as I mentioned, it's also seen in hypercalcemia and ischemic conditions, and this significantly increases the risk of PVTs and ventricular fibrillation, and indicates a poor prognosis for that particular patient. So in a nutshell, cardiac arrhythmias are due to ischemia, electrolyte abnormalities, and depression of conduction system. Accidental hypothermia depresses cardiac conduction along with decreased circulatory response. Body goes in shock, cardiac fibrillation occurs, and that further leads to death of the patient. Moving on to respiratory symptoms. Immediately you have cold shock response. That is basically, if you are put in a cold water, you will have involuntary hyperventilation. I think you might have noticed that when you go in a cold shower, you're like hyperventilating, and that is due to this cold shock response in the body, and that leads to involuntary hyperventilation. And if a person is in water, that person can inhale water during that period of involuntary hyperventilation, and that can lead to drowning of that patient. So decreased temperature shifts O2 saturation curve to the left. O2 binds tightly to hemoglobin. Decreased oxygen is dropped off at the cell. That causes ischemic hypoxia, and that leads to vasoconstriction of pulmonary vessels. And you have that pressure causes fluid leakage out of the vessels, causing edema, and later on it can also cause pulmonary arterial hypertension. Hyperventilation occurs during mild hypothermia, but decreased breathing occurs as temperature decreases due to reduced metabolic rate and decreased O2 supply. So your body's metabolic rate is decreased, you don't need too much oxygen, so your breathing also decreases. And that respiratory along with cardiac depression and respiratory cessation basically is a cause of death in hypothermia. Moving on to musculoskeletal symptoms. Cold causes vasoconstriction, and along with decrease in BMR, decrease in O2 supply causes ischemia. You have less oxygen available for ATP production, and that leads to decrease in ATP production and decreased ATP available for Sarca pumps, that are sarcoplasmic and reticulum calcium pumps. These are ATPase pumps which pump calcium back in sarcoplasmic reticulum, and that increases calcium in the cell because you have less ATP available in the Sarca pump for the Sarca pumps to use. So you will have less calcium going in the sarcoplasmic reticulum, causing increased cytosolic calcium. And then, so more calcium available causes more actin and myosin binding and increased muscle contraction, and this causes increase in muscle rigidity, and hypothermic patient can have rigor mortis like appearance. ATP, as you may be able to recall, that is needed to hydrolyze myosin head to cause separation of cross bridges from actin filaments during relaxation process, and you have decreased ATP in hypothermia, and that also causes muscle rigidity. As we already mentioned, decreased temperature increases the affinity of oxygen binding to hemoglobin. You have less oxygen dropped off at the muscle cells. You have decreased O2 available for ATP production. Decreased ATP causes decreased muscle contraction as well. Basically, you have, as we already mentioned, that in the previous, as your temperature is going down, you have less muscle contraction, and you have 50% decreased activity of muscles as the temperature is going down. So this is due to because you have less oxygen, less ATP production, you have less muscle contraction in a way that you are not contracting anymore because you don't have any oxygen available, you don't have any ATP available anymore. So first we were mentioning that you have more contraction due to causing rigor mortis like appearance, but then you also have you're not contracting anymore. You're basically you're not able to do any function. So by decreasing muscle contraction, that means that muscles are not able to move, and this basically that's why if you try to help this hypothermic patient, they're not able to grab onto anything, grab onto a rope or a rock or anything, because their muscles are not getting any oxygen or ATP. So freezing temperatures paralyze smooth muscle and vascular wall, and that causes, so this is like a last minute and last resort for the body to get some oxygen in the extremities. And so freezing temperature paralyze smooth muscle and vascular wall, that causes vasodilation, and intense warm feeling occurs, kind of like flushing, and this is due in order to prevent ischemia and frostbite of extremities. And this leads to paradoxical undressing, and you'll see hypothermic patients removing their clothes at times. Moving on to renal symptoms, vasoconstriction causes decrease in renal blood flow. You have decreased GFR, and that leads to oliguria. Another mechanism of oliguria is cold decreases renal tubular metabolism, and that reduces sodium reabsorption, and which causes diuresis, and diuresis further leads to dehydration and hypovolemia, and that further leads to oliguria as well. And treatment, you have rewarming, rise. So a risk of treatment you want to remember is that during rewarming, this cold acidotic blood can from extremities can return to the core body, can return to the heart, will return to the heart, and you'll have sudden decrease, a transient decrease in pH and core body temperature, which can further also leads to ventricular fibrillation. So that's all for now.